Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Lung transplantation. Introduction.
Surgery to remove and replace a poorly functioning lung with a lung from a donor who has passed away is called lung transplantation. Most people who receive lung transplants would otherwise die in 1 to 2 years without a transplant.
This program explains lung transplantation. It discusses the transplant surgery, its risks and complications, and how to take care of yourself after surgery. The lungs. Your lungs are a pair of large organs in your chest. They are part of your respiratory system. Your right lung has 3 parts, called lobes. Your left lung is smaller and has 2 lobes.
A thin tissue called the pleura covers the lungs and lines the inside of the chest. Between the 2 layers of the pleura is a small amount of pleural fluid.
Oxygen is vital for life. Without it, death happens quickly. The lungs allow us to fill our blood with oxygen. The air we breathe comes in close contact with the blood in the lungs. The blood fills up with oxygen and releases wastes like carbon dioxide back out into the air. When we breathe, the air goes through the mouth and nose. From there it goes to the windpipe, known as the trachea. From the trachea, the air goes into smaller tubes called bronchial tubes. Small balloon-like sacs called alveoli are at the end of the tubes.
The inner lining of the bigger bronchial tubes makes a special substance called mucus. The mucus helps trap dirt from the air.
Small brushes, known as cilia, push the mucus to the outside. The cilia are like the hairs or bristles of a brush. If the mucus becomes sufficiently big, it is coughed out. Lung failure.
If you have a worsening lung disease that doesn't respond to other treatments, you may be a candidate for a lung transplant.
Early signs of lung disease are easy to overlook. Often, an early sign of lung disease is not having your usual level of energy. The signs and symptoms of lung disease can differ by the type of disease. Common signs are trouble breathing, shortness of breath, feeling like you're not getting enough air, decreased ability to exercise, a cough that won't go away, coughing up blood or mucus, pain or discomfort when breathing in or out. These problems may become hard to control with medicines and can be a serious threat to your life. A lung transplant may be recommended by your healthcare provider.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Transplant.
If you are a candidate for lung transplantation, you'll go on the national waiting list. This list is maintained by the Organ Procurement and Transplantation Network, or OPTN. You will work with your transplant team to prepare for transplantation. This involves going to every scheduled medical appointment and taking your medication as prescribed. Keep doing your breathing exercises, following your exercise routine, and eating healthy as instructed. Avoid smoking. Continue these good habits after transplant surgery. A donor lung may become available any time. Prepare yourself to go to the transplant center at a moment's notice. The center must know how to reach you at any time. You may have difficult emotions to work through while you wait. Feelings such as worry, anxiety, fear, or depression are normal. Talking with supportive friends and family, your healthcare team, or a counselor can help. When an organ becomes available, your healthcare team will make sure that the lung is a good match and that you're healthy enough for a safe operation. If so, your healthcare team will get you ready for surgery.
Surgery.
Lung transplantation is performed under general anesthesia. This means you will be asleep and will not feel pain. The surgeon will open your chest with a lung cut and remove the diseased lung. He or she will then place the donor lung in your chest and connect the blood supply and airway. If both lungs are being replaced, the surgeon will remove and replace one lung at a time. A heart-lung bypass machine will take over the job of your heart and lungs during the operation. The operation will last 4 to 6 hours for a single lung transplant and 6 to 12 hours for both lungs. Sometimes a heart transplant is performed at the same time.
Risks and complications. This operation is safe. There are, however, several possible risks and complications which are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your healthcare provider detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery.
Risks of general anesthesia include nausea, vomiting, urine retention, cut lips, chipped teeth, sore throat, headache.
More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your healthcare providers know if any of these symptoms happen. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs.
Complications are most likely to happen within the first year. The major complications of lung transplant include infection and rejection. Rejection is when your body doesn't recognize the lung as your own body part and creates antibodies against it. This can happen all at once or over time. It is more common during the first 6 months. Your healthcare provider will give you medication that suppresses your immune system. You'll need to take these medicines for the rest of your life. These medications help prevent rejection but make you more likely to develop infections. Seek medical care if you have the following signs and symptoms of rejection: cough or congestion, shortness of breath, new pain in the lungs, fever, flu-like symptoms. To prevent infections after you leave the healthcare facility, you should take care of your skin to prevent scratches and wounds. Practice good dental care, such as brushing and flossing twice a day. Avoid crowds and sick people. Wash your hands frequently.
After surgery.
You'll stay in the intensive care unit, or ICU, of the healthcare facility for a few days after surgery. You'll need to practice coughing and taking deep breaths using an incentive spirometer. Hold a pillow against your abdomen when you cough to prevent pain. Your healthcare provider will also use a spirometer to test your lung function. Most people who don't have serious complications stay in the healthcare facility for 1 to 3 weeks. Before you leave the facility, you will learn how to check your lung function, pulse, blood pressure, temperature, and weight. Make sure you go to all of your follow-up appointments. Pulmonary rehabilitation may be advised to help with exercise training, education, counseling, and more. Follow your healthcare provider's advice on drinking alcohol going forward. It's normal to feel depressed, overwhelmed, or worried about complications after surgery. Talking with your healthcare team, a counselor, or supportive friends and family can help. If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary.
Surgery to remove and replace a poorly functioning lung with a lung from a donor who passed away is called lung transplantation. Most people who receive lung transplants would otherwise die in 1 to 2 years without a transplant. If you have a worsening lung disease that doesn't respond to other treatments, you may be a candidate for lung transplant. If you are a candidate for lung transplantation, you'll go on the national waiting list. This list is maintained by the Organ Procurement and Transplantation Network, or OPTN. You will work with your transplant team to prepare for transplantation. During lung transplant surgery, the surgeon will open your chest with a lung cut and remove the diseased lung. He or she will then place the donor lung in your chest and connect the blood supply and airway. Sometimes a heart transplant is performed at the same time. It's normal to feel depressed, overwhelmed, or worried about complications after surgery. Talking with your healthcare team, a counselor, or supportive friends and family can help. Keep doing your breathing exercises, following your exercise routine, and eating healthy as instructed. Avoid smoking. Follow your healthcare provider's advice on drinking alcohol. Thank you for using Explain.